Hello and welcome to Health Options. I am Rabi Abdullah. Thanks for joining us on the program. Nigeria launched the Eliminating Yellow Fever Epidemic Strategy in 2018, which is a global, comprehensive and long-term strategy built on lessons learned that aims at ending yellow fever epidemic by the year 2026. Yellow fever is an acute viral hemorrhagic disease transmitted by an infected Aedes aegypti mosquito, which bites both in the daytime and at night and is endemic in Africa, Central and South America. Symptoms include jaundice, which is yellowness of eyes, fever, headache, muscle pain, nausea, vomiting, and fatigue. On the 1st, 2nd and 8th of this month, clusters of cases and deaths were reported to the Nigeria Center for Disease Control (NCDC) by the state epidemiologists of Delta, Enugu, and Bauchi. Benue has also joined the list of affected states. On this episode of Health Options, we shall beam our searchlight on the yellow fever situation in the country in terms of prevention, response, preparedness, and other things you need to know about the viral disease.
Nigerians, let us take responsibility. Stay healthy, stay safe, and curb the spread of the virus. Take responsibility. The coronavirus spreads from one person to another. Let us avoid crowd gathering of any kind for any reason. Take responsibility. Avoid traveling from one state to another during these lockdown restrictions. Obey all the rules that are put in place. Take responsibility. Stop spreading fake news and unverified reports about the coronavirus. There is no known cure for COVID-19. Take responsibility. Observe all the measures that can help stop the spread of the virus. Together, we can do this, but only if we take responsibility. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
This is Health Options, and our focus is yellow fever. Just when the country is doing everything possible to stay on top of its efforts at dealing with the COVID-19, there is a resurgence of yellow fever in some parts of the country. That is our talking point with those saddled with tackling the health issue.
Traditionally, the yellow fever is found in tropical Africa and subtropical South America. Now, when that environment, there are things that exposes people to the yellow fever itself. You know, there is a virus. Once you have the breed of mosquito called the Aedes aegypti, that is the one that picks the yellow fever virus and spread. So if there is one person that is down with it and that person is bitten by the mosquito, usually 3 days to when the person starts having fever and 5 days after the person is having fever, that person can transmit if it is bitten by yellow fever. Now, once another person is bitten by that same mosquito, it will come down with yellow fever if the person was not immunized. There are 3 major root cycles of transmission. One, the jungle transmission, where it is picked from the forest. The second mode of cycle transmission is the savanna transmission, which is those people that live in the satellite towns that goes to the forest, come back to the areas where they are living, and then they transmit to others. And then the third cycle of transmission that is called the urban transmission, where maybe somebody now in Abuja travels to the Delta, a northeast local government that is infected now, and comes back to Abuja bitten by the mosquito. That person will also begin to spread it here. that becomes an urban transmission. Once the person is bitten and the virus is deposited and the person did not receive the vaccination for yellow fever, that person will definitely come down with yellow fever disease. So what we are seeing here now is that there would have been a contact from these places to the forest, brought into the environment. The mosquitoes are flying around in those areas that are of that particular Aedes aegypti that causes the yellow fever. So that is what we are seeing, the wave that we are seeing now.
Yellow fever is a viral disease that is being transmitted by mosquitoes of the Aedes aegypti species. Currently, we have outbreak of yellow fever. On the 1st and 2nd of November, we received reports of unknown illnesses from Delta and Enugu State. On the 7th as well, we received a report of an unknown illness from Bauchi. There and then, NCDC deployed rapid response teams to go and investigate and find out exactly what is happening. When our rapid response teams reached Delta and Enugu, working with the states, they collected samples and they sent the samples to the National Reference Laboratory, Gadua, where we were able to confirm that there are yellow fever outbreaks in those states.
Yellow fever is a vaccine-preventable disease, and a single shot confer immunity for life. And it is available for free in primary healthcare centers in the country as part of the National Childhood Routine Immunization Schedule. How then did we come about a resurgence of yellow fever?
Actually, yellow fever is completely a vaccine-preventable disease. We are not supposed to be having these mortalities. People can access, children under 9 months of age can have access to these vaccines at health facilities across the country.
If you look at the age group of the people that are being infected, they are typically in Delta state, 18 years to 25 years. The 32 deaths recorded there, they are within that age group. In Enugu, 47 deaths recorded between June and now. They are also the age group 18 years to 30 years, the oldest. That age group did not benefit in vaccination. You know, the country looking at the trend of yellow fever and wanted to prevent it and eliminate it from the country, started the introduction of yellow fever into the routine immunization system in 2009. Since 2009, our children at 9 months are being immunized. So you can see the trend between that period and now. We are not seeing the cases in the younger age group because most of them have been immunized. But if a child is not immunized and is exposed, that child will definitely come down with the yellow fever. But characteristically, what we are seeing now is the cohort we are seeing are cohort that did not above the age limit that we introduced the vaccine in the country and were never immunized at any point in their life. That is the trend of what we are seeing. As a country, we wanted to immunize all Nigerians at once since 2013. The problem has been the availability of the yellow fever vaccine globally. So the country wanted to maintain the status of zero yellow fever, made a case to the CG to give the country vaccine to immunize. In 2013, we could have vaccine to immunize only three states: Akwa Ibom, Cross River, and Nasarawa. Between then and that extended to early 2014, we now could not have enough vaccines to immunize the adult population again, except for the routine immunization that the government is buying until 2018. In 2018, we could immunize in most states at once. In FCT, it was done. In Benue, we were able to also immunize. We also had in Kebbi, we had in Zamfara, we had in Sokoto, and then Borno State. we had vaccines that we could immunize adults and children 9 months to adults 44 years in those states that I mentioned. In 2019 again, we could have vaccines to immunize only in Katsina. So Katsina eligibles were immunized. Early 2020, we could conduct the campaign in Ekiti and Rivers State. And so these other states that we're having now, we would have had the campaign earlier around May, June, but because of the COVID, we did not. That was when it was rescheduled for November. So unfortunately, we have seen the outbreaks in those states, and we have fast-tracked the implementation of the campaign. For Enugu, as I'm talking also, they have started reactive campaign, yes. So the campaign is ongoing in Enugu. And then also in Bauchi, the report came in to the executive director officially. The zonal director of the Bauchi zonal office with 10 other staff from the zone have moved to the ministry working with the state. They will start responding to the case by ensuring that the vaccines are available and then the eligibles are immunized. In Bauchi, we are looking at 4 local governments for that. The one that is affected now will be covered first, and then in another 1 week, the remaining 3 LGs bordering those LGS will be immunized. And then for the entire of Bauchi state, because of the vaccine availability, their campaign was shifted to January. They would have joined this one. So what we are going to do now is to fast track forward, because we have seen cases coming up now with what is available before the vaccine comes in from the ICG for Bauchi State in January. So those are the scenarios.
After this outbreak, what NCDC also did, aside from deploying rapid response teams, is to activate the National Emergency Operations Center, which is a multidisciplinary, multi-sectoral emergency operations center. And the idea of the center is to coordinate the response working with the affected states. Also, in the rapid response teams, we have clinicians, we have epidemiologists, we also have laboratory personnel who are working with the states to ensure they conduct active case searches, to ensure they sensitize the communities, and to ensure that all aspects of the response are being attended to. So far, this is where we are. And also just to mention to the public that we can prevent yellow fever by taking our children to health facilities for the routine immunization. Also, the National Primary Health Care Development Agency, working with NCDC and the National EOC, is planning to conduct preventive mass vaccination campaign in some of the high-risk states.
In the midst of the coronavirus pandemic, information management is key.
I'm Cyril Stober.
Fatima Umar Buba.
Joseph Johnson.
Ian Ray John.
Muhammad Kudu Abubakar.
Jumbo Yusuf.
My name is Kirian Umaya.
Here in NTA, we're working very hard to make sure that everything we broadcast is accurate and up to date. Misinformation spreads very fast.
The social media has been a huge conveyor of misleading information from one individual to another, then to another set of groups. In a short while, it goes viral, and before you know it, it is all over the world.
There have been several misleading information on coronavirus, COVID-19. Recently, the misconception of 5G as a cause of coronavirus is becoming widespread. Another is the belief that hot beverages and alcoholic drinks are internal cleanser for COVID-19, thereby leading to excessive consumption of these drinks.
The use of local concoctions as treatment for COVID-19 are yet to be scientifically proven. However, there has been several theories about the efficacies of these concoctions. We should stay safe and denounce all manner of fake news and misleading information on COVID-19.
For medical advice, go on the WHO website, Nigeria Center for Disease Control, NCDC website, or stick with the advisories from the Presidential Task Force on COVID-19 or other authentic official sources. NTA is one of them.
Like you heard at the beginning of the program, yellow fever is transmitted by an infected Aedes aegypti mosquito, which bites both in the daytime and at night. Apart from vaccination, what other ways can it be prevented?
The responsibilities we need to take as individuals include the fact that we need to keep our environments clean. Remember I mentioned mosquito, once we have ponds around us, shrubs around us, and so on, it provides a very good breeding space for them. So we have to ensure that our environments are clean. For those who go into the forest, those jungles, and so on, they should wear protectives. They should use long dresses that covers their hands, covers their legs, because the Aedes aegypti mosquito bites both day and night. It doesn't, like most mosquitoes, will only come out in the night. It operates both day and night at any time. So if they are going out to the forest, those living around those areas, they should try and kit up and dress themselves. For those that can buy repellents, we have repellents that they can rub on their skins that keeps away this mosquito. Because if the mosquito that is infected does not bite them, they won't come down with the yellow fever. So they should wear those protectives, they should buy the repellent, and above all, they should ensure they go out for vaccination so that they receive the lifetime immunity that is required.
A yellow fever can as well be prevented by ensuring that we clean our environments so that we don't have, stagnant waters where the mosquitoes can breed. We can also use mosquito nets, insecticides. We can use insecticides. We can use the nets so that the mosquitoes cannot get across to us. So far, this is what we have done, and this is the advice we can give to the general public in order to stay safe from this disease. It is also very important to mention that there is no human-to-human transmission of yellow fever. Yellow fever strictly is being transmitted by mosquitoes. So to ensure that other states do not suffer from this kind of outbreak, like I said, we have activated the Emergency Operations Center, and we have also, sensitized all other states to be on alert to ensure that their surveillance is up and working. They should be looking out for such kind of cases so that they are not taken unawares. I'll just give you a brief example. About 3 days ago, we got a similar report from Benue State, and we were able to pick up quickly the samples. As I'm talking to you now, they are currently running the samples to see exactly what is the cause of that illness. So we'll be working around the clock with all the states to ensure that something like this doesn't happen. Also, we are doing active case searches. We are going around the facilities, sensitizing clinicians, ensuring that index of suspicion for yellow fever across the other states is also heightened. Also, working with the state education health education teams of each state, they are working to enlighten the public, to tell them what exactly to do in order to avoid getting this kind of infection.
Nigeria launched the Eliminating Yellow Fever Epidemic Strategy in 2018, which is a global, comprehensive and long-term strategy built on lessons learned that aims at ending yellow fever epidemic by the year 2026.
I want to use the opportunity to thank His Excellency the President for making provisions that Nigeria buys these vaccines and keep, because if the vaccine was not there, we wouldn't have to respond the way we are responding now. We also want to thank the Minister, Dr. Henry, and the Executive Director for his promptness and in ensuring that there is a response in those states that we are seeing this outbreak. So we expect to see a very sharp decline because there's mass vaccination ongoing in those states.
The number of the COVID-19 cases in Nigeria is increasing daily, with many more tests ongoing. The battle of testing, isolating, treating, and attending to the affected persons rests heavily on the shoulders of our health workers, constantly putting their lives on the line and at risk to contain this virus, save and protect the lives of millions of Nigerians. To these health workers, we at the Nigerian Television Authority, NTA, on behalf of millions of Nigerians, say a big thank you for all that you have done and are doing. To the security agencies enforcing the lockdown and every other frontliner, we say thank you for putting your lives on the line to save ours. There is no amount of words that can quantify our gratitude. Thank you. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
This is where we end this episode of the program. Keep staying safe by observing the safety protocols against COVID-19 and keep mosquitoes at bay to avoid illnesses that come with their bites. You can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdullah. Hope to see you again. Bye for now.